Hey guys, and welcome back to Introduction to Nursing. Today, Destanie Dupps, Mallory Benortham, which is me, and Miriam Guzman are going to teach you all about Nurse Anesthetist, or a certified registered nurse anesthetist. Today, you will learn how to become a nurse anesthetist, the salary, the steps, and even the average age and gender of nurse anesthetists in the field today. So hang on tight and get ready to learn. Now, you may be asking yourself, what is a nurse anesthetist or a CRNA? A nurse anesthetist works with surgeons, anesthesiologists, dentists, podiatrists, and other professionals to ensure the safe administration of anesthesia. A nurse anesthetist can operate in surgeries, births, and pain-related illnesses.
So, you may be wondering, what exactly can they do? For example, they can perform epidural, spinal, or nerve blocks. They can also provide care before, during, and after anesthesia. They can examine patients' medical histories for allergies, illnesses, to ensure safe provision of pain management. And they can also discuss any contradictions or side effects of anesthesia with the patients. And, of course, monitor their vital signs during the medical procedure.
So what education is required to become a nurse anesthetist? First off, you have to receive your registered nurse, aka your RN, along with your bachelor's in science and nursing, aka your BSN. Next comes getting a master's degree in nurse anesthesia, aka CNRA. And lastly comes passing the National Board of Certification and Recertification for nurse anesthetists.
After talking to you guys about the education requirements to become a nurse anesthetist, you may be asking yourself, what experience is required? You must have 2 full years of experience as a registered nurse or RN, 1 year of full-time ICU experience. ICU stands for Intensive Care Unit. Proof of a valid RN license, registered nurse license, a bachelor's degree, and many prerequisites. These can contain chemistry, which is 2 courses of that, human anatomy, physiology, microbiology, and statistics. You must have a 3.0 overall GPA in your coursework, a 3.0 GPA and 5 science prerequisites, a graduate level writing ability. You must shadow with a CRNA, certified nurse anesthetist, or an anesthesiologist. 3 references, a college transcript, ACLS/BLS/PALS certifications. You must have a resume, a goal statement, which is a personal essay, and a background check after admissions. All of these are required by the University of Kansas Nurse Anesthetist Program.
Salaries for nurse anesthetists range from $105,000 every year to $242,000 every year. The average salary in the United States is $157,000 every year. The average annual salary in Kansas is $159,000 per year, and the average hourly salary in Kansas is $76.51 per hour.
Job availability for nurse anesthetists has projected to grow 16.2% from 2014 to 2024. The profession is expected to grow faster than 7.4%, the average rate of national job growth. If you look at the graph, we can see that the job growth for nurse anesthetists is expected to skyrocket from 2014 to 2024. We can see that 45,000 jobs will be available by the time 2024 comes around.
You're never too old to do something you enjoy. The average age of a male nurse anesthetist is 45 years old. The average female age of a nurse anesthetist is 43 years old. That would make 44 the median age of a nurse anesthetist. As of 2016, there was 16,423 females and 11,402 males currently working as a nurse anesthetist. Let's take a look at the chart. Along the bottom are the ages of nurse anesthetists. Along the left side are the number of people in the workforce. The red lines symbolize the women, and the blue lines symbolize the men. As you can see, women around the age of 30 are peaking in the nurse anesthetist field.
I'm sure most of you are wondering, what's the difference between a nurse anesthetist and an anesthesiologist? In this video, Dr. Charles Ellis describes the differences between these two medical professionals. He explains in this video that a nurse anesthetist works under an anesthesiologist. He explains that an anesthesiologist can work alone, but a nurse anesthetist will always be working with an anesthesiologist. To the right of the video, we included just some more information about nurse anesthetists compared to anesthesiologists, comparing the number of practicing professionals in the United States, their average annual income, their minimum education required, and what the cost of their education is.
An anesthesiologist is a medical doctor, and they work side by side with CRNAs you might have heard of before, or nurse anesthetists. And on the morning of surgery, generally you'll meet both of them. Anesthesiologists often work without nurse anesthetists, but you won't see a nurse anesthetist here working without an anesthesiologist. So you'll either meet just an anesthesiologist, or you'll meet an anesthesiologist plus a nurse anesthetist. He or she does many of the same things as an anesthesiologist. They will be there during the surgery to ensure your safety. They're there monitoring you. They're, of course, there to answer questions before and after surgery. And they work independently, but they work under the guidance of an anesthesiologist.
Here are the resources we found to gather information for our PowerPoint. I hope you enjoyed, and I hope you learned more about nurse anesthetists.
If you guys have any questions about the nurse anesthetist field, please ask us now or comment down below. Have a good day.